The government has officially approved a series of reforms to the Chronic Disease Assistance Program, or Cdap. This vital health equity initiative has provided free medication to over 300,000 citizens since its inception in 2003. Reporter Jewel Greene-George has more.
According to the Minister of Health, Dr. Lakram Bodo, a commissioned review found the program's drug list was outdated and needed to be aligned with modern medical practices.
So I am pleased to update the public on this matter that affects the lives of over 300,000 citizens on the Cdap program. Just to indicate that, of course, since its establishment in 2003, Cdap has served as a vital health equity mechanism, providing free, essential medication for chronic diseases such as hypertension, diabetes, asthma, and more recently, mental health.
The most significant change is the rationalization of the drug list. Clinically inferior medications will be replaced with more effective alternatives. For example, the drug simvastatin is being replaced by rosuvastatin, a more potent cardiovascular treatment.
So, for example, in the area of mental health, the drug sulpiridide is now being replaced by a drug by the name of risperidone, which is a more effective antipsychotic agent. In the area of cardiovascular disease, which is a common disease and condition, the drug simvastatin is now being replaced by a drug by the name of rosuvastatin.
The government also anticipates significant financial savings, projecting over $4 million annually saved. This will be achieved primarily by replacing current drug glucose strips with ISO-certified alternatives from India, a move made possible by a new government-to-government agreement.
We anticipate that the total savings of over $4 million will be saved over the cycle of one Cdap cycle, and this will be driven primarily by smarter drug selection and diagnostic procurement, and I'll come to that matter in a minute.
In a bid to enhance access, particularly in rural areas, the government is also removing the $68,000 technology entry cost for new pharmacies wanting to join the Cdap program, a barrier that was put in place by the previous government.
It should not be determined by postcode. In this regard, we are removing the $68,000 technology entry costs previously required of pharmacies to join Cdap. In 2018, the previous government had made a cabinet decision to charge new pharmacies wishing to engage in Cdap a cost of $68,000 to get into the program.
The government says these reforms are a shift from a drug distribution model to one focused on patient outcomes and sustainable management of public resources. Jewel Greene-George reporting for Tobago Updates Television News.